EDDT is such an important option as an alternative to hospital. You know, families and youth, as we're seeing less stigma around mental health, I think we're seeing an increase in using services in the mental health system. The thing about the hospital is it really is for acute and urgent care. It's not a service that, you know, meets the needs of folks that the community is intended to support. You know, ER is a place for people to go if it's life or death, and although suicide risk is certainly life or death, there's resources around mental health in the community that can help mitigate the risks around harm to self that the hospital's not necessarily targeting to meet. You know, the two worlds, mental health and physical health, collide in an ER system, and I'm not sure that they're working as collaboratively as they could be. So one of the things about EDDT is bringing the community resources to families, doing that safety planning, assessing risk, trying to figure out what other services are needed to continue to stabilize, as opposed to having to sit in an ER where people are coming in, having heart attacks, having situations where they need life-saving surgeries. It's just, you know, the system isn't set up for mental health in the way that's most helpful for families from my perspective. Youth and families need to volunteer to participate. I mean, youth over 12 can consent for themselves, and under 12, parent consent is required as well. If youth and families opt to get referred to EDDT, they're no longer in queue for the services at the hospital, so they wouldn't be waiting for a bed at CAIP or on the inpatient unit at Grand River. They'd be deciding that their needs are going to be better served in the community, and they would no longer have a spot in queue at the hospital. When parents and kids are involved with EDDT, there's an ongoing assessment around safety. You know, should kids need to return to hospital? Should crisis require it? Families can return to hospital anytime, and you know, that could be even as per the direction of the support worker in the community. Risk is changing and it's dynamic, and if needs require, returning to the hospital is always an option. EDDT is a stabilization program, sort of looking at what led that person into crisis and what are the factors that we need to work on providing support around. It can be a pathway into treatment, and there is a level of treatment provided, but it's not, you know, it's not a longer term treatment program. It's a brief service, which is really focused more on stabilization and short-term support. One of the really nice things about the model is that there is a clinician attached to the work that we're doing in EDDT. When youth or families would benefit from brief counseling support, it is certainly something we can connect them with. And the clinician can continue to work with the support worker around the clinical needs and sort of assessing for other services. One of the things we do in EDDT, you know, right at the beginning of our interaction with families and youth is assess risk, right? And so coming into the hospital or into the community when youth are no longer in hospital, we're always asking questions around assessing level of risk and needs related to safety. You know, we might be creating a safety plan with a family and giving them a copy and introducing them to some of the crisis services in the community, or we might just be talking about strategies related to safety for a young person, you know, if they have urges to self-harm. But certainly safety is top of mind in the program. We've looked at EDDT as a short-term stabilization program, and that means that typically we're looking at involvement that would be like 4 to 6 weeks for family, perhaps less, perhaps more, depending on need. We also have the ability to help families move into other service pathways from EDDT should that they require more or need other services. It's not a, you know, one-size-fits-all approach. We've had a lot of really positive feedback from the service. The staff that we have working in the program that support families are just amazing. They're folks that have been around the agency for a long time, have a lot of experience working with families and a lot of resources in the community. So we've heard a lot of really positive client feedback about the service. We're still working at trying to establish the partnership with the hospital and making sure that, we're getting to the families that need our service. So that's a work in progress, but overall the response has been very positive.